Hi, Mr. Jones. I'm happy to see you today. Let's talk about your hypertension or high blood pressure. High blood pressure is one of the most common ailments in the United States, and it affects nearly half of the adult population. There are three types of hypertension: primary, secondary, and complicated or malignant hypertension. Primary hypertension is also known as essential hypertension, and it makes up about 95% of the cases of high blood pressure. This type of hypertension does not have any identifiable cause, and it most often develops over time. Often people with primary hypertension don't exhibit any symptoms, which is why it's referred to as the silent killer, although sometimes patients can experience fatigue and headache as a symptom of having their high blood pressure. The other 5% of hypertension cases are known as secondary hypertension, a type that tends to develop suddenly, often due to other underlying health conditions such as renal, adrenal gland, or endocrine diseases, or use of illicit drugs or medications, among other reasons. In these cases, the high blood pressure is typically higher than that of people with the primary kind of hypertension. Also, those with secondary hypertension are typically not overweight and don't have a family history of the disease. The third type of hypertension or high blood pressure is called complicated or malignant hypertension, and it's categorized as high blood pressure with many pathological complications and poorer patient outcomes. Due to your uncontrolled primary hypertension as an African American man with a family history of hypertension and diabetes, your somewhat poor diet, to include alcohol consumption, minimal exercise, and a high stress job, your risk of complications is significant. In fact, African Americans have a higher rate of developing hypertension. They develop hypertension at younger ages, typically maintain higher values of blood pressure, average blood pressure, and have poorer control rates compared to other racial and ethnic groups. This is one of the reasons why it's very important that we have this conversation to educate you on the high blood pressure and ways to reduce it. All these factors have likely contributed to your inability to control your blood pressure. And if we don't make some changes at this point, your hypertension is likely going to worsen, causing coronary artery disease, as well as other major health issues. Interventions at this point for you are crucial. It's crucial that we start a hypertensive medication for you. We get you on a path to improving your diet, increasing your physical activity, and even decreasing your stress. Complicated hypertension can affect your body in many ways. High blood pressure can cause many issues, like I said, with your heart and your blood vessels, including a heart attack, stroke, coronary artery disease, and heart failure, as well as complications with the kidneys, eyes, and brain. Unfortunately, as you saw with your parents, untreated hypertension or complicated hypertension can essentially lead to an early death, and we really want to make these changes to prevent that for you. While hypertension can have hereditary, like with your parents, and environmental factors, modifying your diet and physical activity can help improve your high blood pressure, as well as starting on a blood pressure medication. You've taken a big step in improving your hypertension and overall health by coming to see us today, and we thank you for that. Let's go ahead and try and talk out this problem for you and get a plan set for you to reduce your high blood pressure.